I'm Dr. Meredith Travelstead, and I have Lindsay Hughes with me today. We're talking more again about why we love having our patients deliver at Baptist Hospital, and Lindsay is one of the reasons. She is our Women's Services Chaplain, and I just wanted her to talk a little bit about why she does what she does. She's so caring and instrumental in support of our patients. We normally think about obstetrics being a happy, joyful time, and everything's wonderful with new life brought into the world. But Lindsay is often consulted at a time when patients are struggling, they've had a major life event. So talk a little bit about the chaplaincy at Baptist Hospital and why you do what you do.
Well, as a chaplain here, a lot of our role, it encompasses the emotional care and the spiritual care of people. So we're in a really vulnerable moment of their life. And there are many vulnerable moments of people's lives. So when you're having a baby and you're going through those things, it's very, very vulnerable. So there's, as you said, a lot of excitement surrounding, a new life coming into the world. And for me, my personal story kind of informs a lot of why I do what I do. We don't have enough time to go into it all. However, there's a lot of personal things that have happened in my own story that have informed the way that I see women and their families during this time. I had a sister that did have a child that she lost, and it was a very difficult time for her. But what it did was teach me a lot about how to be there with people when they are having a difficult time. And a lot at that time I did not know. I may have said too much or did too much, but hindsight now I realize just the ministry of presence and the power of that. And so because that informs how I see people now, that is something that translates, I think better, I hope better, into the work that is done here. And as I said, there's the happy times, and then you mentioned there are the difficult times too. And with not only the women that are delivering the babies, but their spouses and their own parents that had hopes and dreams of different things, different outcome for their families. The mom, if they've had other children involved, how the children in that family react to tragedy when it hits in this supposed hopeful and what is a dream to be joyful that may not turn out to be that way. So again, that ministry of presence comes into play, and just being with them in the midst of that is just an important aspect of our ministry here as chaplains, for me, especially in the women and children's services area. And one of the things that I'm really excited about that we kind of implement during those tragic times is follow-up care. And for women that are experiencing the difficulties, maybe an outcome that they had not hoped for, I follow up with them as soon as they're discharged within a week, and then continue on following up with them for an entire year, just to help kind of the navigation through the questions they may have, the things they just want to talk about. I may not even have to say anything at all. They just may want to get some things off their chest. And so kind of like becoming a close friend in a sense with them. I'm not like their close friends, but I hope that I can become a trusted person that they can share things and know they're not being judged or feel any sense of shame for the questions and concerns that they have. So
have you had that well received when people are in the midst of that kind of stress? It's got to be hard.
Yes.
To open up to someone, and did they receive it that well?
Yeah, I think what I've noticed is that the opening comes when I say I don't understand. When I say I do not know what this is like, even if I've had children or I've lost children, and our story would be somewhat similar, just me saying I don't understand, because at the end of the day I truly can't. Even if we had something to relate to, it would still be their story, their their tragedy or their joy, or it'd be my tragedy, my joy. So I may relate, but I still can't understand. So when I say I don't understand, that's a huge opening for a sense of maybe trust. Some of those walls kind of break down, and they're going, she didn't come in here telling me what to do. She didn't tell me she knew what I was thinking. She didn't tell me any of those things. And so I've noticed so far, with just that one simple statement, that opens it up. And so it's like floodgates kind of open up after that, which is pretty remarkable that people will respond that way when you say you don't get it.
And I'm sure it helps to have someone who's not emotionally entwined in what's going on, to have a person to bounce these things off of.
Yes.
But I do, many times I've asked you to see patients, and she's not only support for the patients, for us as well, because we're so busy trying to deal with the medical problems, and we know that the patient needs that kind of support emotionally and spiritually, and it's so nice to have someone to take time to come and sit with the patient, and like you said, sometimes you don't know what to say in the midst of a tragedy, and just being available, a shoulder to cry on, someone to pray with, it's just so wonderful. And your background is social work and missionary. She was a missionary. Fun fact about Lindsay, a missionary. She and her whole family, right? For how many years on the mission field?
We were there full time for about 3 years, but we've been there since 2012 and still do that work now. So.
Still going back and forth,
Still going back and forth, right.
That's great. So God had a plan for you, even way back, going through that tragedy with your sister, and now she's helping people every day here. It
is a ripple effect, as you said. Like, it's not just patients and their families, but it is the staff, and
definitely
they have to navigate through the tragedy as well. So that has been another dynamic of the whole thing that I really, really love, because it has become like its own family in that department. And so just to hear their joys of their own children and their own families, and then their own tragedies and hard things that they experience. So all around, it's just where I'm supposed to be.
Well, we're very thankful for you. We're very thankful for this part of the team. It kind of completes how we can take care of patients, mind, body, spirit, the whole team working together, and another reason that we're so happy to deliver our babies at Madison Hospital.